Whenever we hear in the news about someone well-known or famous suffering a cardiac arrest, of course it makes us more aware of the risks we are all in on a daily basis. A week ago, the Danish soccer player Christian Eriksen, a 29-year-old athlete, suddenly suffered a cardiac arrest. So in the news you might have heard heart attack, but it's not really a heart attack. It's an arrhythmogenic cardiac arrest, meaning his heart suddenly stopped because of an arrhythmia which leads to a complete standstill of the cardiac function. Ventricular tachycardia, ventricular fibrillation, that's how we call that. So obviously this player was resuscitated on the field. He received CPR, so the bystanders and the medical personnel, they brought him back to life and brought him to a hospital, and as of today we heard now he is getting an ICD, meaning a defibrillator will be implanted in order to avoid further events like that. So the question is, why does a young athlete, a healthy guy like this, who is not a diabetic, who doesn't have the classical risk factors for heart disease, suddenly suffer a cardiac arrest? So the answer is oftentimes there are actually congenital conditions, meaning someone is born with abnormalities, maybe of the electrical system in the heart, for example what we call the long QT syndrome, or other abnormalities which can lead to irregularities. Or there can be certain conditions of the heart muscle, like a thickening from birth of the heart muscle, what we call hypertrophic obstructive cardiomyopathy, which we often see in young players, athletes, who suffer sudden death during their competition, during their physical activities. It is a condition which we need to be aware of, and we as physicians and cardiologists in particular pledge since years to have all professional athletes and even the non-professional athletes checked before you go into competitions, before you undergo heavy physical exertional exercise. Have your heart checked, make sure we're not missing anything. You might not even be aware of a congenital condition, because the exercise, the exertion, the physical activity, combined oftentimes with dehydration, because we are sweating a lot during those activities, makes it worse. This is not the cause for the arrhythmia or the sudden death, but can be a trigger among other triggers. So just keep in mind that irregularities of the heart can be serious even in young healthy people. In general, if you want to be an athlete, if you want to do exercise, which we all of course promote, we all should exercise at least 30 minutes a day, 5 times a week, to a moderate degree, if not more than that. Have your heart checked beforehand. Make sure we are not missing any underlying congenital conditions, we are not missing any abnormalities of your heart rhythm, your electrical system, or your heart muscles. So it's always good, before you undergo a strict and strenuous exercise program, check your heart out. More to come.